75-year-old Chua Eng Hock was admitted to hospital in October last year. He refused to leave even after he was discharged.
Sometimes they say that, oh, how can you be so heartless? How can you not take care of my mother, my father, just give me some time.
Why are hospitals thrust with the responsibility of caring for our elderly? How does it further strain the bed crunch they already face? Get Real finds out just how serious this problem of hospital overstaying is. "75-year-old Chua Eng Hock is suffering from chronic obstructive pulmonary disease, a lung condition that causes shortness of breath. There is no cure for his ailing lungs, and he is completely dependent on this oxygen concentrator. In October last year, Mr. Chua's condition took a turn for the worst. He was admitted to hospital. After approximately 1.5 months in the intensive care unit of a restructured hospital, doctors certified him fit for discharge. Ironically, Mr. Chua's family was extremely upset with the news.
We actually told them that there's no way we can discharge my father-in-law. Totally no way. We couldn't actually really take good care of him at home because of his lung conditions, which the doctor already advised that it will definitely deteriorate as time goes by because of his age and because of his COPD condition, where he need to rely on the oxygen concentrator. Is keep running 24 hours.
This is the amount of medication Mr. Chua has to take every single day. Other than his failing lungs, Mr. Chua also suffers from high blood pressure, diabetes, and high cholesterol. It is obvious he requires 24/7 care. But Mr. Chua is a widower and has been living alone for the last 6 years. His 4 grown children, all with families, are unable to commit to caring for him round the clock.
The hospital sounded to us that if they say my father-in-law is fit to be discharged, he is considered clear of medical condition, and we still not ready to bring him back, the hospital is going to charge us for overstayer fee. I find that the hospital system, they are very rigid. They just really go by the book, whereby they should actually they have to actually look into the family conditions.
Get Real speaks to a doctor in one of Singapore's restructured hospitals. She tells us that Mr. Chua's situation is not an isolated one. Due to the sensitivity of the issue, the doctor agreed to be interviewed only on the condition of anonymity.
There are many reasons why families are reluctant to bring patients home. For example, number one, they think that they are unable to cope with the patient and the illness. Number two, they are afraid that the patient's illness will worsen and they will be at a loss as to what to do.
What do hospitals do in the eventuality that these patients don't go home?
Usually after 2 weeks, we would really try to either move the patient to a sub-acute ward or step-down care, because there are so many patients waiting for these acute beds. We can't let these patients hog these beds for too long. Yeah, otherwise the A&E will just overflow.
There's still this misperception on people's part, that the hospital is the place for many of these problems, because the best care, the best doctors are there.
Hospital overstayers are putting a strain on public hospitals by adding to the already severe bed crunch. Most Singapore hospitals are running at about 90% occupancy. Private hospitals aim for an occupancy of about 70%. Anything higher, they say, is less than ideal. This is because the available beds must be kept free for critical emergencies.
The bed crunch situation at public hospitals is actually pretty bad. Bed occupancy is about 90 to 95 almost every day, and patients have to wait for a very, very long time before they actually get admitted to the ward.
What are some negative impacts the shortage of beds has on other functions of the hospital?
Probably it gives the public a very bad impression of the hospital. Patients will say don't go to this hospital because the waiting time is just so long, and yeah, it affects the reputation. And sometimes when people talk about different hospitals, we do compare hospitals, services, waiting time, and everything. So, but these are things that can't be helped. Everyone's trying their best to get things moving.
This video was sent to Get Real by a viewer. It shows a hospital running near full load and having to put new arrivals in corridors. That's just one measure. Other measures include renting ward space from the private sector and delaying non-critical surgery.
There are several factors. One is the coming of age of the baby boomers. So our population is aging, so suddenly there was a surge. Then on the supply side, we have also had a very rigorous cost containment program, especially in the public sector. So you want to hold down costs. At the same time, you're not going to be increasing your supply of hospital beds and the public spending. There will be a crunch somewhere.
Despite being certified fit for discharge, Mr. Chua remained in hospital for another 3 more months. There are currently an estimated 425 patients like Mr. Chua. They need only nursing home care, but are staying put in hospital. If these 425 patients move out, it would free up about 6% of the 6,700 public hospital beds. But where can these patients go?
Call, and then each call you get from the nursing home is no bed available, no bed available.
"71-year-old Madam Chu has been a resident at Sue's nursing home for a year. She is one of 24 elderly residents at this home. The bed she has in the nursing home didn't come about easy.
We were actually quite helpless, and we were thinking, if we really cannot find a place, what are we going to do? 3 of us, include our spouse, we have to take leave, to be at home with her. But then again, even though we are at home with her, if anything happens to her, if if she has side effect on the medication and all, what can we do? And how can we react?
Madam Chu suffers from a mental disorder and relies on medication. In 2011, her condition took a turn for the worst. She was sent to a restructured hospital for treatment.
She was warded for 3 months, and then suddenly one day, my mom called me herself. She says, the doctor say, maybe next week I can be discharged. So I was like, huh? Next week? What are we going to do? So sort of panic at that moment.
Audrey and her 2 brothers were not able to provide the full-time care that their mother needed. The family decided to send her to a nursing home. Audrey started calling the homes, only to meet with rejection after rejection.
It's like you are left with 1 week. And it seems like you have so much you have to do. Call, and then each call you get from the nursing home is no bed available, no bed available. It really worries me. I really have to think very hard. What am I going to do if I cannot get a nursing home at the end of the day?
While Audrey ran around finding a nursing home for her mother, Madam Chu had to stay on in hospital. She remained there for 2 weeks after being declared fit for discharge. Today, there are about 60 nursing homes in Singapore, providing a total of 9,300 beds. Half are run by voluntary welfare organizations, or VWOs. The other half are private nursing homes. The average waiting time at these homes hovers between 4 to 6 months. Andrew is the director of Sue's nursing home. He receives about 3 to 10 calls a day, requesting for a place in his nursing home. The frequency of calls increases during the holiday season. With only 24 beds here, he finds himself having to turn away families a lot of the time.
Our patient discharges are very few. Usually there are, at any point of time, there's a 2 to 3 person waiting list. And waiting time can range from a few weeks to years. It depends. So I had one patient who stayed for 10 months until a subsidized bed was available and was discharged. I had another patient that stayed for about 7 months until a nursing home place was available. The wait for a subsidized nursing home is quite a lengthy period.
Other than nursing homes, families also have the option of sending their elderly parents to community hospitals. Singapore has 6 community hospitals today, providing 840 beds for patients who do not require acute care, but not stable enough for a nursing home. But even community hospitals are facing a crunch.
So the question then is, if we had anticipated this, why have we not built the facilities? Part of the problem is, when you start building some of these institutions and step-down care in neighborhoods, it's going to be fiercely rejected by the community because, it would lower the property prices and so on. So this NIMBY syndrome, not in my backyard syndrome, has always been there.
Audrey finally secured a bed at Sue's nursing home after calling about 20 nursing homes. It was the only one with a bed available at that time.
There are very few occasions where the bed is available, yes. Unless the bed will only be available either because the patient has passed on or I admit the patient here for short-term care.
Plans to build more nursing homes are well underway. Health Minister Gan Kim Yong has announced that by 2020 there will be approximately 20 to 25 new nursing homes being built. That's double what we have now. But experts are now suggesting that perhaps the problem is not simply one of insufficient supply.
We have to probably look at the total system. So when you have a shrinking family size and the increasing proportion of old people and fewer working people and increasing in a more materialistic urban environment like Singapore when you all have to work, what will happen? We will then have to push our old and our sick into the market, and the market fails dismally. So we have to address this problem together. From a policy perspective, you probably have to emphasize, a lot more development of the step-down care facilities in the community, near the home, and to encourage people to keep their patients and their old folks for as long as possible in their own homes and within the community, and not to put them in institutions.
If really we can't find any bed, then probably I have to quit my job to look after her. Yeah. So I was just hoping that it won't, because the cost of living in Singapore is so high now. I have 2 kids going to school. Depending on my husband's income alone, it's not enough. Maybe the hospital should be a little sympathetic with people like us.
Patients' families expect hospitals to be more understanding. Hospitals, on the other hand, need to free up beds as quickly as possible. What then can be done to solve this conundrum? "71-year-old Madam Chu needed full-time care upon discharge from hospital. Hiring a domestic helper was not an option for her daughter Audrey, who did not think a helper would be able to cope. After 2 weeks, Audrey finally found a private nursing home for her mother. The hard truth is, the cost of leaving her mother in hospital was actually much lower than the cost of a nursing home.
Some they will come back and tell me, oh, because your mom have mental problem, we have to put her in a room, a 2-bedded room, and that will cost $2,500. And then plus her monthly medication that she has to take when she has to go back to NUH is about $400 over each time. So it will come to about $3,000 a month.
There are about 60 nursing homes in Singapore, with about 9,000 beds between them. Costs range from about $680 to $2,800 depending on the resident's condition and the amount of care required.
We are not entitled to government subsidy. To us, we are not very well off, and then of course we are not at the lower end, of the income level. We are in the middle, and we are really stuck. The most tedious part, most frustrating part is you can't find bed when you need it, or if they have bed, the cost is so high.
Monthly, Audrey has to pay about $1,500 for her mother's stay in the nursing home. With government subsidies, Audrey paid only $600 per month for her mother's stay in a 4-bedded ward in a public hospital. She is not entitled to use her Medisave for the nursing home charges.
The incentives and financing are not there to encourage more of the step-down alternatives to hospital care. So if your financing and your incentives are all in favor of hospitalization, that's the result you get, because it's easier to use the 3M, our Medisave, MediShield and MediFund for hospitalization, whereas there's a lack of subsidies and financing for alternatives like step-down care. Who's going to be paying for those community-based services?
75-year-old Mr. Chua has 4 working children. They too are not entitled to any government subsidies. Mr. Chua suffers from chronic obstructive pulmonary disease, a disease that will only worsen with time. He needs 24/7 care. Despite the doctor saying he could be discharged, Mr. Chua's family left him in hospital for another 3 months while they looked for alternative arrangements.
Yes, I find that that my father-in-law is hogging the hospital bed is because that, since the doctor already certified him that he is fit to discharge. But I say no is also because we don't have anybody that can really take care of him, and he really needs full attention.
Mr. Chua's family only took him out of hospital when the hospital threatened to charge them an overstayer's fee. Still on the waiting list for a nursing home, they hired a domestic helper.
2 Panadol for his pain, and this one is for diabetes.
TB Panadol.
Yeah. Sorry.
Fast motion one.
What is that?
That sweet one.
At times, we are actually very upset and very angry with the hospital when they keep pressing us to discharge my father-in-law, whereby we got nobody to really take care of him. Since the day he was discharged, every day he complained pain. And he kept asking for Panadol, for painkiller. And the maid was very stressed up. He got to call me, whether can she give, because the time is so close. But he was, he was actually, my father-in-law was very angry, when the maid refused to give him a painkiller. So no choice, we just have to give, as and when there's pain.
2 weeks after his discharge, Mr. Chua was admitted into hospital again. The pain was too unbearable, and the family was helpless.
We can just throw money at a problem, and we can build fancy facilities, but unless we also emphasize the training and the values that we want to impart on the people taking care of old folks and patients, we will always have this problem. So the training and imparting of good values, and care, it is everybody's responsibility.
The number of elderly in Singapore above 65 will triple by 2030. Now, there are 6 working adults to 1 elderly. In 2030, it will be just 2. The immense challenges that this silver tsunami will bring are real. There are policies in place to resolve the crunch faced by homes and hospitals. But perhaps more needs to be done to address the mindset towards who is responsible for taking care of them.